Hi all, my name's Ellie. I'm a massage and sports therapist at Physio SA in North Adelaide, and today we'll be talking about TMJ dysfunction or temporomandibular dysfunction. TMJ dysfunction is the muscles around the temporomandibular joint. They get quite stiff and they can cause some symptoms like migraines, headaches, toothaches, even ringing in the ears. So you can get quite severe symptoms from this one. Some of the muscles that are involved are the masseter. So the masseter runs from the angle of the mandible down through here and runs up into the zygomatic arch. This is one of the strongest muscles in the body relative to its size, so it can get quite tight and stiff and cause some really big problems. The other muscle that we'll work on today is the temporalis muscle, which also helps to close the jaw. So today we're going to be working on those muscles and some self-massage techniques to relieve any headaches or discomfort that you might be getting in through the jaw. Some of the main causes for temporomandibular dysfunction are stress, grinding of the jaw, and tension through the muscles. We can also get TMJ dysfunction through trauma. So this can be any impact, and what happens is the jaw just tends to lock on, and sometimes it's quite hard to release those muscles. A couple of self-massage techniques to release off, firstly the masseter and the temporalis muscle to relieve these headaches and tension in the jaw. So first we're going to start off with a myofacial release. So this is releasing off the fascia around the joints and just warming up the muscles and the fascia in particular. So what we're going to do is we're going to grab two fingers on the side. We're going to start at the angle of the mandible, so just down the bottom here. Starting at the bottom, and what we're going to do is in and upward pressure and just gliding all the way up. So starting at the bottom, and you should just get natural oil in your skin to help you release this. You shouldn't need any sorbeline or anything like that, but if you're finding it difficult you can always add a little bit on. So just gliding right over the top. So that's the masseter there, and now we're going to go up into the temporalis muscle. And go slow with this one. It is a slow release or a stretch. A lot of people like to think of it as a stretch. So you're going to come all the way up, and you can do this a couple of times right over the top and down again. Starting at the bottom again and working your way up. Nice and easy. Can be a little bit uncomfortable. Just lighten off your touch a little bit if it gets to an uncomfortable stage. Alright. I'm only going to do it twice, but if you could do it 3 to 4 times, that will warm up the area quite well. The next technique that we're going to use is trigger point therapy. So we're going to do this on the masseter. To find the masseter muscle, it originates from the zygomatic arch or the cheekbone and comes down to the angle of the mandible. So what we're going to do is just above the angle of the mandible, pop your fingers in, and what we're going to do is clench our jaw nice and tight. So you should feel the muscle pop up underneath your fingers. Then what I want you to do is just add a tiny bit of pressure. You should start to feel it'll get quite tender. And when you find that tender spot, we're just going to hold and sit in there. Now, there's no certain amount of time that you should do this for. It's very individual, so when the pain and pressure starts to lighten off or you start to feel a decrease in the pressure, that's when you move on to a next area. There'll be a few trigger points around here, so holding in and moving up. That's it. Now the next stage is optional. It's just a bit of a hold and opening up the jaw, so it's a bit of a pin and stretch. So we're going to hold the muscle exactly the same as what we were doing before when we're releasing the trigger point, except this time we're going to open and close the jaw. So just take this one easy. It can be quite painful, but just do it to your own comfort level. So holding in, and we're going to open the jaw 5 to 6 times. And then once you've done that, find another spot. Just under the cheekbone there, you'll find a good one. And again. And It's quite normal to feel a little bit of referral pain with this as well, I better add. You might feel it in behind the eye, and it can refer in around down into the back of the head as well. Just a common sign of a bit of a tension headache, and that's completely normal. Thanks for watching, guys. If you do experience any pain or discomfort due to the massage, please seek further medical advice.